My name is Michelle Rice. I am a mother of two boys with severe hemophilia. I also have mild hemophilia. I've been around the block, obviously, on health insurance costs. My oldest also had Hep C and epilepsy, which thankfully both of those are cured, but we've definitely been through all of the different things in health insurance. So, what I really want to talk to you guys about today is what you should be looking for, reminders, because open enrollment started Friday in most places. And so I want to remind you what you should be looking at when you're choosing a health insurance plan. Now, it's going to depend on what type of insurance you have and where you're getting your insurance. What do you need to manage your condition? First of all, can I ask, are you hemophilia or Glanzmann's or platelets? Factor 10? Huh? There you go. I have one of those too. I don't. My youngest son does. So what do you need to manage your condition? This is going to be really important when you're making your decision. Currently, do you have your health insurance through your employer or through your through the marketplace or through Medicare? Yeah, but through commercial insurance, through his employer? Oh, well, there you go. You want to be able to stay on that for a while. Okay, you got a little bit of time left. Where do you get your insurance? Is it through Medicare or through? Okay. Okay, so you have a Medicare Advantage plan? Okay, great, great. Okay, so there are different timelines, obviously, for Medicare as far as your open enrollment time periods, but you still need to know the same things, right? And what I say is you need to know things like what is the, uh, you know, what medications do I take? Who are my doctors? Who are my hospitals? We'll talk a little bit about that. But first, I just want to remind everybody why health insurance is important. First of all, nobody ever plans on getting sick, right? And so I believe this is a class that should be taught in high school. Because when you go out to get your first job, what do? You ask, how much are you going to pay me? How much vacation time am I going to get? What are my advancement opportunities? And insurance is kind of this like secondary thing, right? Because a lot of us, healthy all of our lives, we go out there, this is our, we're just kind of making our way in the world and we don't have health issues. And so I think it's really important that we learn why health insurance is important and take our time in picking and in looking at our options. So, why is it important? Obviously, it's for financial protection. It helps cover the high costs of medical care. Now, yes, you do have some out of pocket costs as an individual, but obviously it would be much more expensive for you if you didn't have a health plan. It also guarantees you some level of access to quality care, to the specialists you need, a network of doctors, a network of hospitals, urgent care centers. Almost all plans, especially if they're an ACA or an Affordable Care Act certified plan, they have to cover certain preventative services. So at least you have access to those. And again, saves you money because typically those are covered at, $1, the preventative services. You also have reduced out of pocket costs. The insurance plan traditionally covers a good part of the cost of your medical spend. I mean, yes, you have a deductible. Again, this is why it's important to choose which plan is best for you, but you do have a deductible, you do have an out of pocket. But for the most part, even that is a percentage of what that is actually really costing. So it's important that, again, having a healthcare plan can reduce your out of pocket costs. For me, the big thing is peace of mind, right? You know that you at least have some coverage in the event you get ill or you are injured. To me, that's a stress reliever, right? To know that I at least have that coverage in the event I need it. In some countries, it's a legal requirement. If you remember, originally when the Affordable Care Act came out, it was required that everybody have health insurance. There was called the individual mandate. You had to have health insurance or you had to pay a penalty. That is one piece of the Affordable Care Act that did get amended, and now it's not required. They still strongly encourage you to have coverage. Here's why they want everybody to be covered. If you think about it, if only people who are sick are covered, costs are going to be exorbitant. And how are they going to spread that out across the people that are covered? It's going to cost us more. You need the healthy people in there too. You need more people in there, recognizing that some are going to use a lot more services, some are going to use a lot less, will help balance that cost out and hopefully bring the costs down. But the other thing that that has is chronic condition management. Again, I used to get frustrated when I would get calls about this for my kids when they would say, oh, we're a disease management, service that's available. We're going to help you manage your disease. And I was kind of like, well, quite frankly, I think I'm doing a pretty good job of that. I don't need you to do that, right? But in reality, I've really become a fan of some of those here lately because they really do help you coordinate all of the other services that you need, not just your bleeding disorder services. So in other words, we're lucky if you're going to a hemophilia treatment center, they do a lot of that coordination for you, right? You have access to comprehensive care. But if you're getting your care from just a local hematologist, they may not do all of that coordination with your primary care provider, with a surgeon that you have, with the dentist, the same way that, you can get through comprehensive care. So there is some value for those chronic condition management. And I encourage people to ask when their insurance company says that they offer it. I encourage you to ask them, well, what does that entail? What is that? What do I get for that? There's usually not a charge for you for that, but what is it that you get for it? And then you can decide, do I want to use it or do I not want to use it? Sometimes having that case manager actually works in your favor. And the reason I say that is by them kind of managing everything and making sure you're getting to your appointments, you're getting the things that you need. A good example is mental health. If you're getting all of those things, then in a lot of ways, chances are that your medical costs are going to come down because you're going to be compliant with your treatment. You're going to feel better. You're going to all those things, right? That's what a lot of them get judged on, right? Is their performance, is how well are they doing that? How well are they helping you with that? So in reality, it not only helps you stay on track, but it will also potentially help lower costs in your health plan. So the other program that they have are some of the health and wellness programs. What I love about this right now is I know, at least in the marketplace, and I know with some of the Medicare Advantage plans, and I'm sure that they have some of this with some of the employer plans as well, but they will have certain, resources available to you. It may be videos that you look at. It may be articles that they put up for you to read. It may be that you, for every time you go in and get like your annual wellness visit, you'll get points. And then what happens is with those points, they will send you a gift card that they say, all right, on here you've earned 250 points, therefore you have $25 towards, you can use towards your copays, or you can use towards utility assistance, right? To pay your utility bills. With Medicare Advantage, sometimes it is what they'll let you do is use that towards getting certain types of groceries, right? So again, some of them may just give you an Amazon card or whatever for doing those things, but hey, it's a reward. It encourages you to stay on track, get your, your wellness checks and give you something in return for that. And ultimately, the healthier you are, the less your costs are. I'll give you an example. My father has a Medicare Advantage plan through Anthem. Now, what he gets is $120, so it's $40 a month towards utility assistance if he's, doing what he needs to do. So he gets that throughout the year. Then he gets, I want to say it's $50 or $60 a month that can be used for either over the counter or groceries. Now you can choose, sometimes there's different benefits you could choose. Instead of those, you might say, well, I don't want the over the counter stuff. What I would rather have is transportation assistance or something else. These are called supplementals. You'll hear Medicare talking about you can get up to $3,000 in supplemental care, on a Medicare Advantage plan. And everybody always calls and asks me, they think they're going to get a $3,000 check. You're not going to get a $3,000 check, but what they're going to do is give you benefits equal to that. It could be dental coverage that you want, some supplemental dental coverage. It could be over the counter meds. It could be this utility assistance, or it could be something else. Now, not all of the Advantage plans do that. Just like the Marketplace plans. I'm in a Marketplace plan. And the Marketplace plan has several different things at different times in the year, like open enrollment. They go through a lot of stuff that you can read through. And then there's certain visits, like if I do my mammogram every year, I get so many points. If I do my yearly wellness check, I get so many points. And then I get a gift card that I can use either for my copays at the doctor's office, not for prescriptions, but at the doctor's office, or I can use it for utilities. And it's great, actually. It's just like you would go into your utilities and you might pay with a credit card on your bank card, your debit card. You put in this card and it will do that. Some utilities will charge you like $1.95 fee for doing that. But I think in our state, Eric, I think it's the utility, or it's the electric company that charges the $1.95. The gas company doesn't. So it's just weird. But again, so this is like these extra benefits that you need to find out if they have those or not. Now, Humana has something similar, but not the same amounts. And so, again, you just look at your plans, and it may be, in how they describe that. You can talk to your broker who may help you if they're the ones that help you get your plan, or you can talk to, like, if Anthem is who you go through or United Healthcare is who you go through, you can talk to United Healthcare and say, what kind of supplemental benefits do you offer? Okay. So, obviously where you get your insurance can differ. As we've heard, you get yours through Medicare, you get yours through being on your parents' plan. Some folks get it through their employer, some folks get it through the Marketplace. It's really important to understand where you need to go to get your plan, but also what type of plan to pick once you go there. So, for example, if you get a plan through your employer or through your parents' employer, it matters for you to know, is it a self-insured employer plan or is it a fully insured employer plan? Let me explain to you the difference on that. For example, where does your dad work? What is that? Okay. I guarantee you they're self-insured. Probably. And what I mean by self-insured means they are using, let's say it's Blue Cross Blue Shield. Is it United? Okay, in your case. All right, it's United. If you look at your card, your insurance card, everything will look like any other United card, but you'll see at the bottom something that says this plan administered by United Healthcare. That means they are acting as what we call a TPA, or a third-party administrator. That means that the employer has contracted with United Healthcare to utilize their network of providers, to utilize their administrative folks to process claims, but who is writing the check is actually the employer. They are paying for those costs. Let's see. Yours is, oh my gosh, my eyes are so bad. It should say on the back, submit medical claims to. Oh, I'm going to have to print that so I can look at it, because I can't I can't see it. My eyes are so bad. Sorry. I left my readers upstairs, but I'll look at it for you. But if it doesn't, it'll just say a United Healthcare Company or a United Plan or whatever that is. Now, for Medicare, it's different. For Medicare, it's different. They are a Medicare plan. They are administering it for Medicare. So it is still the government plan. It's just with a self-insured employer, it will say administered by, and for that, that means that that employer is self-insured. The reason you need to know that is self-insured plans do not have to comply with all of the Affordable Care Act provisions, which you'd think is odd, right? When it's a government plan that your dad has, right? Ironically, they don't. So many state organizations, many city organizations are self-insured. So like city offices, federal offices are self-insured. Huh? Oh, yes. Teachers are usually self-insured, meaning the school district, yes, right? Meaning the school district partners with a United or whoever, and then they're the ones writing the check. If it is a fully insured plan, that means that whoever's on your card, that insurance provider is taking all of the risk. So they'll go in and they'll look at an employer's history and they'll say, okay, here's what your medical spend has been in the past. Here's what we're going to charge you for premiums for, you know, families, individuals, married couples, right? Here's what we're going to charge you. And let's say that that totals $2 million in premiums that they're charging, but 3 million gets spent in medical bills. The insurance company pays that other million. They've just lost $1 million on that, but they have to pay it. That's their risk. With an employer, it's a fully insured employer, or I mean, a self-insured employer, the employer is taking that risk. Most employers will set aside in their budget a certain amount of money to pay for healthcare coverage. And so let's say they set aside 3 million and it's 4 million that year. They got to come up with that extra $1 million. So it's important to know that so you know who's paying the bill, but it's also important that if you have a complaint or a grievance about your policy and you want to go to somebody with a fully insured plan, you go to the Department of Labor. If you have a self-insured plan, self-insured plan, you go to the Department of Labor. If you have a fully insured plan, you might go to the State Insurance Commissioner. In your case, you would go to CMS if you had a problem with your Medicare plan. You would go to the Center for Medicaid and Medicare Services. So you would go to CMS. No, okay, great. No, go ahead.
Can you talk about traveling with a bleeding disorder, particularly out of the country? How helpful are travel insurance plans?
Well, that is a good question. I will say, first of all, you need to really look at what your plan is. If you have and if you're somebody who does travel out of the country, or even if you're someone who travels a lot domestically, this is one of the things that I mean about picking a plan that's right for you. If you choose a plan that is an HMO or a health maintenance organization, which is usually, if you're with an employer, they'll have a high plan and a low plan. A lot of times a high plan may be what they call a PPO or a preferred provider plan, or they'll have an HMO, a health maintenance organization. An HMO requires you to use doctors that are in their network. If you use anyone outside of their network, typically you have no coverage for that, and it will be required that you pay the full amount. That's important if you're somebody who travels a lot, right? In my last job, when I worked for the national organization, I traveled, 3, 4, 5 times a month. I needed to know there's a chance when I'm on the road that much, I'm going to get sick while I'm on the road. If I just go to a urgent care center or something that's not in my network, I'm probably going to be at risk for paying for that. A lot of insurance companies will say, we will pay in the event of an emergency. Great. They decide what an emergency is. And a lot of times, if you look at what emergency says, it says threat of loss of life or limb. Well, I can think of a lot of other things that would be an emergency to me that don't qualify at that level. For example, if I'm traveling a lot on a plane, if I have an ear infection, that is incredibly painful to get on a plane. I would consider that an emergency. They may not. So it's important that you think about, do I have out of network benefits? If you're somebody who travels a lot, you probably are going to want a PPO or a preferred provider organization that offers you in network and out of network benefits. Now you may pay more for that out of network benefit. Like let's say your in network benefit costs you $25 if you go to an urgent care center. If you're out of network, it may cost you $50 to go, but at least there will be coverage for it. As far as international, that's a whole other question. Many employers will offer that as part of their package. I would very much clarify with them, what does that mean when you say that we have travel insurance? What is covered? I was out of the country once with a colleague who ended up in the hospital, and we had to pay up front and then get reimbursed when we came back. Ireland. So there are differences, so it is important that if you are somebody, that is something that I would clarify with the health plan before I make my choice. So hopefully that answers that question. I don't know if okay. Okay, well, if you have a PPO, that's good as far as being out of, your coverage area, like maybe if you are in another state. Now, the other thing to find out is, does that PPO have what they call a national network? A good example is United Healthcare. United Healthcare typically has a national network, which means you're still going to pay in-network cost, even though you're out of your service area, because they have a national network. So that's a good thing to know too. You probably have a national network. No? Oh, it may not show that on here. It, really? And you told them it was Medicare? Well, we'll look at that. I'll look at that for you offline. But again, those are the kinds of things that you need to be asking when or need to be keeping in mind when you make a choice. The other thing that you need to do is to think about, as I said, you need to know, what are the services I need? Because you could buy the top insurance plan that they have. They used to call them Cadillac plans, right? Oh, it covers everything. It may cover everything but one of the things you need, and then it's not worth it to you, right? You could be paying great. It has great coverage if I had this, but I have this and it's not covered. So it's really important to think about it. And it's important to think about more than just your condition. For many people, you are on a family plan. Now, you are on a family plan. Now, Medicare, it's your own individual plans. But if you're on through your employer, or even in the marketplace, sometimes you can get family plans. These are family plans. So remember, yes, factor is always one of those things that for a lot of us is right at the front of our minds all the time, because we see that big bill, right? It's never like $50. It's never like $500. It's a lot, right? Right. So we know about that. We know to look for that. Okay. But I'm also going to give you some tips on how to ask about that as well. But what you need to do is, I tell them to fill out a patient medical history or a personal health information sheet. What that is typically, I've created some examples. You can go to the National Bleeding Disorders Foundation's website, search for personal insurance toolkit, and you will be able to get some of these forms. But I'm also developing that for NORD, so you'll be able to go to their website as well too to get that. But basically what I've done is, when I ask you to fill out your personal health history, what I want you to include in there is, who are your doctors, whether that's your primary care doctor, your specialists, anyone in your family. You want to fill one of these out for everybody in the family. You want to fill that out. You want to also go, what are the maintenance meds that any of us take? Don't worry about the times that you have to take something for, I have strep throat. Well, that's a temporary thing, right? You're usually going to take that medicine maybe once, maybe twice. But what are those meds that you take every single month? We'd often don't think about that because we're writing a small check when we go and get those. But when you sit down and add that up, you're going to be surprised at how much you're really spending at the local pharmacy too. So what I have listed on there again is those things that are typically come with a copay or a deductible, co-insurance that I'll list on there. I'll say, you list your maintenance med, list your, how many times do you go to the doctor in a typical year? Most of us know if this last year is normal for us. Yeah, I went to the emergency room twice. That kind of happens almost every year. Or I went to see my hematologist 3 times last year. Or I went to see, my primary care doctor for a sickness, not for, your annual exam, whatever, because those are typically covered a lot of times without a copay. But how many times did I go because I was sick? And you write that down. And then what happens is you have all of this listed out so that when you actually sit down to look at your health insurance options, the plans you can choose from, you'll know to say, okay, I'm going to look at my provider network. I'm going to take a look at the provider network and I'm going to see if all my physicians are in there. And I'm going to go through and I'm going to check that off on my list, right? All right, is my husband's, are his, doctors covered? Okay, what about the prescriptions? Okay, the prescriptions are covered, but what level are they covered at? Is it a tier 1 where it's maybe $10? Is it a tier 2 where it might be $30? Or is it a tier 3 or 4 where it could be $75 or $100 or maybe more? And I'm going to write that down. Well, now there's a big change for Medicare coming in 2025. The maximum you are going to have to pay is $2,000. Yes, yes. Yes, and it will be $2,000, which is a huge change for folks. So that is good. But what I'm saying is you still want to know, are your drugs covered? Because that's critical for you to know. And how much is it? So that you can plan, how long is it going to take me to hit that? Am I going to hit that in a month? Am I going to need that in 6 months? Or am I going to need that in 12 months? Maybe I won't even hit it, right? So we'll figure that out. I know we will always hit it. We will always hit it. So it's important to think about, you're going to have all this information so that you can really tally up what is it going to cost me if I use this plan. All right, what about if I use this plan? What is my cost? You're going to figure, you're going to be able to include what are all my out-of-pocket costs in an average year? What is my deductible? What is my premium? Okay, which one is more affordable for me? It may actually be that that PPO plan may actually cost you less. Your premium may be more expensive, but more of it's covered, so your out of pocket is less. That may be a better plan for you because it also gives you flexibility in case you had to go out of network. I've listed some keywords. I'll use the term trigger words. If you see these in your plan, you need to read this. You need to find out what those are. What are the prior authorization requirements for me for my medications or for a surgical procedure? How long before that do I need to submit that? Does my doctor need to submit that to make sure that it's covered? The other thing is preferred drug list or specialty drug list. Sometimes you'll see that as PDL. That is typically the formulary. That is the list of the covered drugs that they're going to cover. Now, those are all of your drugs. It's generics, it's, preferred drugs, it's non-preferred drugs. A lot of times they will have a separate drug list called a specialty drug list where you would find clotting factor or where you would find expensive biosimilars or other expensive medications or medications that require special handling are probably going to be on a specialty drug list. You will not find this on their website. They often don't have it listed. Sometimes they do, but it is very difficult to get to. You want to call them if you can't find it. Oh, yeah. And I will tell you how to do that. First of all, clotting factor is covered under Part B. It is covered under B. However, in employer plans or in marketplace plans, most marketplace plans, we will find factor covered under prescription drug coverage. If it is for home infusion, if you're doing it yourself, and the same for employer plans, if you are going into the clinic to get it, if you have to have a nurse come out and help you infuse, a lot of times that goes under major medical. So the problem is sometimes when you're on a employer plan or a marketplace plan and you go, I'm using XYZ medication for clotting factor. How is that covered? Is that covered under my plan? And is it covered under medical or pharmacy? They may say both, which does not help you understand what your out-of-pocket costs are going to be. What you need to say to them is, how is factor covered when it's being utilized at home or for self-infusion? You want to know that because it does impact what your out-of-pocket costs may be. Because you may have 1,000 under your insurance that you have to pay. You may have under the medical, but it may only cost you $50 a month under your pharmacy plan. So it's important to know how that's covered. So you have to have that distinction. The other one is, what's my maximum out of pocket? What are my out of network benefits? Again, in many of these marketplace plans, you don't have out of network benefits. Accumulator adjuster or an accumulator maximizer. Again, you are not going to have to worry about that on your Medicare plans, but you are absolutely going to have to worry about that on many of the employer plans. And some of those are starting to filter into some of the marketplace plans. There is yes, some of the adjusters are getting into or maximizers are getting into the marketplace plans. They're just starting to come into that. They're much more likely to be in the self-insured employer plans. There's something else that's in the self-insured employer plans. This is not in the marketplace plans as of yet. It's not in fully insured employer plans, but in self-insured plans are something called that we refer to as alternative funding programs. Now, let me just say to you that rarely are you going to see this called a accumulator adjuster or maximizer. They're going to have verbiage in your plan that says, we have a standalone pharmacy, standalone pharmacy coverage or standalone pharmacy program or cost saving, a pharmacy cost savings program. You see those things, you need to call and ask exactly what that is because it is not explained in there and it makes it sound very good to you, but I can tell you it's going to affect what your out-of-pocket costs are. With these alternative funding programs, what they are is because self-insured employer plans do not have to cover all of the ACA requirements, a lot of them are saying, we're going to exclude specialty drugs. We're going to exclude specialty drugs and gene therapies. We don't have to cover those. Well, but we have engaged with a standalone pharmacy program who is going to be able to help you get those drugs at either a much lower cost or free. We need to have you sign up with them and they'll send you information to sign up with them. What those people really are doing, they say they will either get you the medications through a foundation or a charity. They'll have in small letters or manufacturers, GAP programs or PAP programs, which are their assistance programs. Those assistance programs that they're talking about are not the copay assistance programs that pharma has. What these are assistance programs that pharma has for if you are uninsured for a drug or underinsured for a drug, or it's not on formulary, they will provide you some assistance with that drug until they'll in the background be working with your insurance company to try to get that drug covered. No one creates something to give away for free, right? I mean, they spend billions of dollars to develop these drugs. They're not going to give them all away free. But the fact of the matter is there are still financial requirements usually attached to those programs. So they are not always successful in getting you on one of these programs. And then what happens is because they have excluded those drugs, you now don't have coverage, right? So that is a dangerous trend that's going on. It's something that there's a group called All Copays Counts Coalition. They are trying to fight this in Washington, D.C. I know the Hemophilia Federation is working on it. I know the National Bleeding Disorders Foundation is working on it. I know there's a lot of questions as to if this alternative funding model is even really legal. And so there's a lot of challenges happening that way. So, but these are all things you need to know about because you don't want to get into a plan and then find out you have this problem and not have access to your drugs. This should not apply. None of these should apply to Medicare. Okay, go ahead. Let's get those.
Comments, really. I have a lot of good information. How many states are limiting their marketplace insurance plans to only in-state healthcare organizations? Is there federal legislation to prevent this?
There are I just looked at this over the weekend, and it all depends, what state you're in. Remember, some states ran their own marketplace. They aren't using the federal healthcare.gov marketplace. So they could make some different rules if they wanted to. So, but even within the federal marketplace plan, what I have found is there are very few PPO options in those marketplace plans. And if they do have them, they are expensive. I just looked for some of those myself, and they are much more expensive. Now, some will have more than others, some will not. But I would venture to say that I'm guessing a good, and this is just off the cuff, probably 75, 80% of those plans are HMOs, which means they're not going to be outside. Now, you could also look for an EPO. There are typically in the marketplaces HMOs, EPOs, or POS or PPOs. Again, you're probably not going to find many EPOs either. That is an exclusive provider organization. And a lot of times they will have a national network. For example, the last employer I was with, they had an EPO plan. So we had a national network we could use when we were out of our coverage areas. But again, you have to look at it. No, unfortunately, there's not a requirement that they have that. There are some requirements in the ACA, for example, on what actuarial value is in a health plan. And, that looks at, you have to have so many providers within a certain number of miles from someone's home or from your service area. You have to have reasonable access, right? It may say you have to have X number of specialists within a 50-mile radius of whatever, or 100-mile radius. That gets very confusing. If you really want to look for a description of actuarial value, one, you can send me a message. I'll send you information on it. You could probably go on to healthcare.gov and look for something that explains a fact sheet on actuarial value. It will explain that as well. But there are some rules, but typically they aren't out of your state, right? They are in state, for your networks. I'm going to say I'm looking at that and it's $1,100. I don't know if that was an individual plan or not. But what I will tell you is most of us are used to what we had to pay through an employer, right? It may have been $100 a paycheck. It may have been $250 a month. It may have been $400 a month, but it was for a family. What I'm going to tell you, that is not really the cost of an insurance plan. If you knew what your employer paid for each one of those, let's say I had a family plan through my employer and it was costing me $400 a month. It's probably costing the employer an additional $2,000 a month for me to have that. So you need to understand that really $1,100 sounds like a lot, and most of us don't have that setting aside somewhere. But what I can tell you is realistically, when you think about what your healthcare is costing you, we all know, look, I may pay, let's say I pay $10,000 for premiums, and let's say I pay another $7,000 out of pocket. $17,000 is a lot of money. What is the cost for taking care of me through health insurance? I have a son that's $1 million. My other son was $1 million. Okay, they are definitely losing money on my plan. That's why there used to be an individual mandate. That's why we wanted for everyone to go into get health insurance, because you have to have healthy people in there to offset those of us who are high utilizers. And look, anybody with rare disease, we're about 5% of the population. We make up about 95% of the healthcare costs. So it is, when you look at it that way, you go, oh, that's kind of a deal actually, because I don't want to be paying that, but none of us could pay that anyway. So what I'm saying to you is your employer, when you're having to choose through an employer, and actually when you're going on the marketplace, they have these documents as well too. When you look at a plan and you want to compare it, it'll say plan documents. You want to go and click on those and download those to look at them. But what you'll be able to get is the easiest thing to look at is a summary of benefits form. That will be available on the marketplace. It will be available through your employer plans. It'll actually be available for your Medicare Advantage plans as well. It will show you what are the in-network benefits, what are the out-of-network benefits, because now with your Medicare Advantage plans, some of those are, I mean, that's the whole purpose of an Advantage plan is it's usually an HMO. You usually have to be in network with an Advantage plan. But if all your doctors are in network, I'm personally a fan of those Advantage plans. I know some people don't like them. If your doctors are in network, I think it's a good plan. It can be very affordable. If they're not in network, you're looking at needing to go traditional, and with supplements and the other things that you need. You should get a list of the drug formulary. The drug formulary will show you, again, what are the drugs that are considered preferred or non-preferred, which ones are tier 1, which ones are tier 2, which ones are tier 3. We are actually now all the way up to some that have 6 tiers, which I don't know how they keep moving things through there, but yes, you have those in there. And again, those are typically going to be your traditional retail drugs is what I'm going to say. Those are not going to usually be your specialty drugs. Those are going to be on a specialty drug list. And you're going to need to look at those as well to know what your out-of-pocket costs are. You also want to have either a copy of your provider network listing, or really have a link to it so you can scroll through and search to make sure your providers are in network. Also, you'll want to be able to search usually in your provider network. You can see if a certain facility is in network. Those are important things to know. Have a calculator handy, because what you're going to do on this personal information sheet is not only are you going to list all those things, when you start listing, here are the 5 drugs, I'm going to go in and find out what each one of those drugs costs. Now I'm going to multiply that by 12 because I'm taking it every month. And I'm going to write that on my list of how much this is going to cost me so that I can compare what these plans cost. I will tell you right now, you could go to the National Bleeding Disorders Foundation's website. They do have a health insurance toolkit. You'll search to find that. And on there will be a glossary of healthcare terms that includes the most commonly used terms you'll find in insurance plans, and also the most commonly used acronyms. Much like government, insurance uses a lot of acronyms. It's important to know what they are, as we just sat here talking about EPOs, PPOs, and studies show that most people spend about 30 minutes to pick out their health insurance coverage. I am telling you, if you decided on your health plan in 30 minutes, you did not do a good review of that plan. And yes, it stinks. I have looked at hundreds of health plans in the last 30 years and helping other people and doing my own plans. You need at least an hour, if not a little longer. And typically I'll go through, I'll compare it, I'll set it aside, I'll come back and do it again a second time, just to make sure that I've found everything that's in there. Then there will be some questions that I will go one step further, and I will call them the plan that I want to choose. I'll call that insurer to ask questions. Hey, I saw in here that this doctor is covered, but when I called the doctor, he says he's not in the health plan. Can you confirm for me that they're in the health plan? And by the way, what is your name? So that you can write that down, write down who you talked to, and then say, if they say, yes, it's in network, you say, can you send me that in writing, or can you point me to where it is in the plan? or in the provider booklet that shows me that that provider is in network. That's important to do. The other thing is, again, with the factor, you say, okay, if the factor is covered for home use and it's covered under the pharmacy benefit, who can I get that from? Do I have a particular pharmacy I have to go to? If so, who is it? Where can I find that in my health plan? Every once in a while, they'll actually mess up and send it to you in writing. I love when that happens. Put that in a folder. I have all of my notes when I talk to my health insurance company. I will tell you, I sat on the board of the high risk pool in the state of Indiana for 20 years, and I served on the grievance committee and the appeals committee. And I will tell you, how many times do you get on there? And the first thing they say is, this call may be recorded for training purposes, right? Until you call them and say, I called, and you guys said it was recorded. They'll go, oh, well, we don't record all of them. I'm here to tell you, yes, they do. If you are calling in with a complaint, if you're calling in with a question like that, they're going to be recorded. You want to be able to say, I called on March 7th. I talked to Miss Smith at 1:00, and this is what she told me. You want to be able to say that because miraculously they will find the fact that, yes, that was recorded. Let me go back and look at that. Because I used to get a stack like this thick of all the stuff I had to review before a grievance meeting because we had it all recorded. So again, have those things in front of you, have a pad of paper to write yourself notes. Sometimes, let's say it does say my doctor's in network. I'll call and ask them to confirm the doctor's still in network. And I may even call my doctor to say, are you in this network? Because you want to make sure. Again, I want to double check everything. I don't want to rely on the fact and assume that there's not a mistake somewhere. The other thing is, a lot of us will get a plan that we love, and boy, we want to stick with it. We don't want to change. I get it. But I'm going to tell you, every year our rep used to come in when we would buy our health insurance at work, and they would say, the broker would say, hasn't been any changes. Like, really? Are you sure there's no changes? Are you telling me that every drug that was on the formulary last year is on the formulary again this year and at the same level? And they'll go, well, no, some of those may have changed. Okay, well, can you tell me that all of my doctors that were in there last year are in there this year? Well, there could be some. Okay, then don't tell me it's exactly the same, because it never is. It never is. And again, I may have 6 of you sitting in the room that all have Anthem policies. Unless you all work at the same place, I'm going to tell you there's going to be differences between all of those policies, because Anthem may have 100 policies. United Healthcare may have 200 policies. And the other reason to know if you're self-insured, if your company's self-insured versus fully insured, is, again, who you go to if you have a problem. You're going to go to the Department of Labor. Also understand that it's a lot of times it's not the insurance company that you see on your card that's making the decisions about what's covered. It's the employer. The employer, a lot of these large employers have health information people who make the decisions about what kind of drugs they want to cover, how many drugs they want to cover, what kind of extra services they want to cover. So you need to understand your employer does have a lot of influence over what is covered in your plan. Again, the other thing I'm going to tell you to do, and we don't do this a lot because honestly, we're overwhelmed, right? With all the stuff that we have to do as people with rare disease. Okay. What I will tell you is appeal. If your doctor says to you, I need you to have 6 weeks of physical therapy, and you're told, nope, I can only cover, they're told, no, we'll only approve you for 6. Then you say, well, what happens if we need more than 6? They may say you have to come back and get authorization for additional ones, but you can also appeal that decision and have the doctor submit a letter of medical necessity that says this. Now, I will tell you, there are strict rules about the timeline you have in which to appeal. When they tell you that they're denying something or that they've approved it for less, they need to tell you right in that letter, here are your options for appeal. They will tell you that you need to follow those. You need to work with your doctor's office to do that. But you need to go through the process to do that, because a lot of times those do get overturned. I can tell you, in 20 years of working on the grievance committee for a insurance plan that had all of the high risk patients in it in Indiana, I'd say 90% of the time they were getting overturned, and we would end up approving them. So again, there is a process. You need to follow through with it. They have to give you the information on how to do it. So again, some of that information you may be able to find on NBDF's website. I don't know if they still have some of that updated information. I'm going to be putting that information out through the National Organization of Rare Diseases in a couple of weeks. So it will be available somewhere. So, you know, again, there's lots of places you can go to find that. You can go online and just do a search, even through AI, you know, through Chat GPT. You can go in and say, what are the what are the rules around appeals in fully insured plans, health insurance plans? What are the appeals? What is the appeals process timelines in Medicaid or in Medicare? It will provide you that information.
There's so many great comments on the virtual chat, and I'm so sorry for individuals typing this. It's a really good information. We just don't have time to go through all of it, but I just want to comment. This one right here. She says several years ago, her plan decided to change within a 2 weeks notice, and they switched the self-insured. Her company basically changed plans on them in 2 weeks because they thought they were doing them a favor by maintaining their premiums, but then she was out of pharmacy network by the change that they did on her.
I'm going to say something that is not popular in our community. Now, when you say you were out of your pharmacy network, did they have other specialty pharmacies that you could go to? Was it that the specialty pharmacy that you had been using was not in network, but were there specialty pharmacies in network who could have given you your product? If you can let me know that, that would be great. I will tell you, for a long time in this community, we have been very used to being able to say, you know, we want to be able to go to whoever we want to be able to go to get our drugs. What we need to understand is that there's only 20,000 people, with 20 to 30,000 people with hemophilia. Now there's a lot more in the US. In the US, there's a lot more with VWD, that kind of stuff. A lot of them may not all be, you know, documented, and many of, you know, there's not as many with Glanzmann's. There's not as many with some of these others. The way these insurance companies that now have to take everyone because of the Affordable Care Act, the way they control their costs is by economies of scale, right? You can't have, if I'm an insurance company and I have 50 patients that have hemophilia, and I'm going to put 25 specialty pharmacies in network, and each one's going to have 2 people, I'm not going to get any good pricing. I'm not going to get those things. So you need to understand that there is a reason that they limit that. There really is a limit. What I'm going to say to you is there's a lot of different types of access issues. One is a true access issue. What I mean by a true access issue is you don't have access to a pharmacy that has ever dealt with hemophilia, that doesn't have those products on hand, that can't get you products in a reasonable time period, whether that's 24 hours, 48 hours, 72 hours. If they can't get you that drug in that time frame, or they don't have the supplies necessary, or they're not sending you the correct items, that's a true access issue, because you're now not being able, you know, there was one company that would always send the medication, but no supplies. I can't just walk in somewhere and go, can I have some syringes? Can I have needles? Right? Those kinds of things. Or they would send it and they wouldn't send the right supplies with it. Okay, that is a true access issue. Is it because I know this company, and this has happened to me? I was with the same company for 15 years with my child, and I had to change to a different company. But you know what? They could get me my products. They billed my insurance correctly. I got my supplies with it. Did I like their person that I talked to as much as I liked the person who had known me for 15 years? Not really, but it doesn't matter. What matters is that I got the drugs I needed and I got the supplies I needed. That is a preference issue. That is not an access issue. And there are many times that we will help you fight for a preference issue. But I'm going to tell you, if you saw the real costs that these insurance companies are paying, I could not believe the pharmacy spend that we had on the high risk pool that I was on the board in for 20 years. I don't even know how we were being able to pay those costs. The pharmacy spend was more than the hospital spend. For 10,000 people on that plan, our pharmacy plan was more expensive. We paid more every single month than we did for hospitalization. That tells you something, because hospitals are way overpriced, right? So there's preference issues, there's access issues, and, and then there's also, service issues. And again, we get used to having what we want. And what I'm going to tell you is it's kind of the conversation you sometimes have with your kids about wants versus needs. I'm a firm believer in we should ask for what we want. But what we need to know is, what do we need? Because right now there are plenty of people in this country who are not getting even what they need in health insurance. So we do have to be a little bit more understanding, and we're not going to get our choice of every provider. Or if we want to, we can choose to pay a bigger percentage of that cost. That's up to us to decide if we want it that badly. Question?
My son is 11, and right now, we get insurance for him through my employer. But I'm wondering, how does that work when he will be having to do it on his own? Like, what age? When do things change for him? Like, how can I plan? Is it 18 when he has to get his own insurance, or?
You have insurance for your work?
Yeah.
Insurance on your plan until he's 26.
Oh, okay.
Yeah, what happens is after 18, after 18, he's on your plan, but he's an adult. And so at that point, the doctors will ask to speak to him unless he signs something designating you his medical designee. And believe me, you want for him to do that stuff on his own. But, I can tell you, in my family, I'm everybody's medical designee, except for my kids. Ironically, they do it on their own. The rest of the family all puts me on there. But remember this, the ACA did put in place some other things, right? Many states chose to expand Medicaid. So they've increased the financial eligibility level for Medicaid. Now, some states have, some states haven't. Yeah. So, but again, I think there's going to be, there are going to be health insurance is one of those things that changes every single year. Every single year, there's going to be some tweak. There's going to be some change. Remember what happened with the ACA? The ACA was about getting access, and it accomplished what it wanted to. More people have access to coverage. That was not health reform. That was the start of insurance reform. Now we still have to have more insurance reform, and we have to have more health reform. It is going to be so hard in the US because we have a very bifurcated system. Everybody has, you've got Medicaid, you've got Medicare, now you have the marketplace, then you have commercial plans. There are a lot of things happening, but I can tell you that the cost of healthcare in the US is rapidly exceeding what that cost is in any other country. We are way above what anybody else pays for healthcare. And so we are reaching, in my opinion, a critical mass. And I work with health insurers right now. This is what my business says. I work with health insurers. I work with self-insured employers. There's a lot of conversation around, and a lot of people are wanting to come to the table, wanting to collaborate to say, okay, we're going to have to work together, or this is never going to get fixed. And so it won't happen overnight. We'll still probably be having this conversation 10 years from now. You'll be wheeling me in a wheelchair as I'm telling you how to change.
Yeah, they quickly got back. Their CVS was who they were with, and they said it was a disaster. They also said that everything you spoke about earlier happened in a matter of 3 months with them, and then they didn't ship in a timely manner half the time.
Yep.
So.
Okay. All right. Yes. In that situation, they have now become a access issue. Wasn't a preference issue, but it became an access issue. And what happens there is, this is what happens when we have these situations where there's only one provider that's allowed or two providers. Now at NBDF, we would say there should be a minimum of 2 to 3 different providers available in network for pharmacy. One should be a 340B option, one should be a specialty pharmacy option, but there needs to be more than one, and they need to be more than a choice on paper. What I mean by that is, we got one time and it was like, it listed all of these local pharmacies. I'm like, there is not a single one of these pharmacies that I'm going to walk into and ask them to get Factor and they're going to have it. And one of them did say yes. And I said, okay. I said, this is how much I need. This is what my last shipment cost. Dead silence. And then they came back and said, yeah, we're not going to be able to do that. I said, yeah, I didn't think so. So again, those are the kinds of things that advocacy organizations help argue against. Those are things that, you know, in my work, those are the conversations that I have with health plans when they call me and say, look, we're going to make some changes. Are these reasonable? Are they, you know, so again, I know we don't like to talk to our insurance companies because we like to believe we're riding underneath the radar. And you know what? 30 years ago, that was true. We were a blip on the radar screen. They didn't know who we are. But I'm going to tell you right now, they know exactly who you are, how much Factor you're using, who your doctor is, where you live. They know all of that. The best thing you can do is work with them. Look, I always say there's always a time for righteous indignation. And I've worked in the advocacy space for 34 years. Yes, there's always time. There's always opportunities where you need to run in there like your hair's on fire and say, this is what we need and you need to do it and you need to do it now. If you start there, you're not going to get what you need. We need to start saying, okay, here's what we need. Here's what happens if we don't have this. Here's how this increases your cost, Mr. Insurer. And here is how it, you know, affects my outcomes and ends up with me having further joint disease or, you know, spending more hospitalization time, those sorts of things. I will tell you that the only way our health is just this, I'm now going to get on my soapbox. Sorry for those of you on the call. We all have a responsibility to keep our healthcare costs low. That means from the manufacturer to the wholesaler, to the specialty pharmacy, to the 340B program, to the hospitals, to the patients. Yes, it is very expensive for us. It is hard for us to meet our premiums, our copays, our deductibles. But when we go into Congress and we go in and say, it costs me $1 million a year for my Factor. No, it doesn't. It does not cost you $1 million, but Congress needs to know it's costing $1 million. And they need to know that all these people have to change. Everybody has to, you know, do their part. And what you have to do as a consumer is to say, you know what? I know I'm expensive, right? I appreciate that coverage. And the way I show you I appreciate that coverage is when I get my medication, I take it as prescribed. I order my medication on time so I don't end up without any and end up in the ER. I do these things because now I'm healthier. And guess what? I don't have all these extra costs. I don't have joint disease. I don't have, you know, extra hospitalizations. I'm not hitting the ER every weekend. I am doing my part to keep costs low. And you know what? I still have to pay $18,000 out of my pocket or $20,000, whatever it is, because that's a lot of money. Even to somebody who's making hundreds of thousands of dollars a year, that's a lot of money because that's just for you. So again, we all have to do this. We all have to come in, sit in a room and know we're going to have to make some compromises somewhere. But the goal is for everybody around us to make some compromises, for us to make sure that the patients can at least leave there with what they need. And that's what we want to have. So I'm just saying we all have to think about this. Election time is next week. I'm not telling anybody who to vote for, why to vote. I'm saying know the facts about what you need related to healthcare and think about that when you go next week. So
We should probably end in about 5 minutes.
Okay. Anybody else have any?
Just a lot of good content, but
Okay, good. Okay, yeah, yeah. Eric can send me anything. If there's any questions that haven't been answered, I can get those to you, Eric. I don't know if you can get them to the folks that have asked the question.
I just have a quick question about a service issue. If you're having trouble getting the supply from a specialty pharmacy in this particular, can we say who might, she? One of those three initial places. And they have the medication, but are delayed my need for it. I mean, I went 9 days with a serious bleed and they would not get it to me from another location, but I was unable to travel to get it. Who do we complain to with that kind of thing? Because it's not that they didn't have it. They had it. They just didn't care.
Now, is your insurance through employer? Or I would go right to my HR, or I would go to the pharmacy board in my state. There is a pharmacy board that you can go to and you can say, hey, here's what the situation is. This is my, and you can go to the insurance commissioner's office. Both have places where you can file complaints. I know that we have met when I was at the national organization. I had met with the pharmacy board. I live in Indiana, so I've met with the pharmacy board and I talked to the insurance commission a lot. If you can't get results from them, that's when you go to your local legislators too, to complain about that. I know people are nervous about going to their employer, but all you need to say to them is, I have a medication that I need that is supposed to be delivered to me within this much time, and they're refusing to get it to me because they have to get it from a different location. My guess is that location, oh, well, yeah. Oh, yeah, you and I need to talk about that because I probably know who that is, but
I asked you before about my insurance, United Healthcare. I had to travel out to the state. The other hospital where I'm supposed to go says they absolutely don't want to take any part of my insurance. How can somebody manage that?
what's really very frustrating, and this is with Medicare, you know, I asked this question of the Center for Medicare and Medicaid Services because we had people that were being turned away from places because, for example, clotting factor, whether you know this or not, is typically not, well, it is paid for through Medicare, but through some other Medicaid, some other places, it's not paid for when it's in the hospital because it's part of what they call a DRG rate, your diagnosis or your daily, I'm going to forget DRG. I can't even believe it. Something grouping. I'm telling you, my brain's on fry. I'm sorry, guys. But to me, they can turn you away. And what they can say is, well, we don't have that here to take care of you, so we can't do it. Now they're saying, or they can say, we're turning you away because reimbursement's horrible and we're not contracted with them. That would be a big question for me with Medicare. And I'm actually surprised. Well, what I think you do is you call United Healthcare and you ask them, you say, look, I travel and I'm going to this particular hospital and they're telling me they don't accept United Healthcare. A, is there anything you can do to help me with that? Or B, is there another hospital that's close by? Now, I don't know, when you were in Arizona, was it Banner Healthcare you were? I just did. I know people that live in Arizona, so I'm sorry. I didn't even mean to say that out loud. I'm sorry. Yes. Oh, Danielle, if she's there still, we need to talk to her. I wasn't sure she was still in Arizona. I thought she was somewhere else now. I will reach out to her and find out if she can help us in any way. But then I would say also just go to United Healthcare. But I'll talk with you offline and I'll see if I can help in any way. I may not be able to, but I've worked with Medicaid in Arizona and Banner Health. So again, you'll find a lot of hospitals that don't carry clotting factor because they may never, think about it, they may never see a patient. Now, oh yeah. Oh, no, but they don't like to bring it. Well, you can in some places and the only reason um, in Indiana now that we don't bring it in anymore is because it took 8 years and we got a rule passed. The only people who weren't being reimbursed for it was Medicaid. And we're the only state that got a law passed that they have to reimburse separately for clotting factor if they're a Medicaid patient. And so that's why because we had the whole battle over, well, you can't bring it in. I'm like, well, what do you want me to do? Yeah. So what would happen is they would get you stabilized and then they would push you off to some other hospital, all down to, in our case, either IU or St. Vincent's, and those hospitals would lose a ton of money. So we were able to get that passed there, but but this shouldn't happen. Well, now here's the question though, not that this is ideal, but if you go see her, you may be able to go to a different lab to get your lab work done there in Arizona that is covered, which is a pain. You shouldn't have to go all these different places. But I'm just saying to you, there may be that possibility, which is why you would want to talk to United Healthcare. But let's see what we can figure out there first, and I'll help you with that.
All right.
Thank
just-
you for those of you on here for.
Just another, can you read it? Sure.
Yeah, where it says trauma centers and cardiac surgical hospital. Oh, which one? No, I agree. That's what that was what I was just trying to explain is that hospitals and ERs, yes, we do have the product at home. The problem is for them, there is a chain of custody issue for them when they bring it into us, right? They know that it's delivered to us at home, okay? But chances are they go, we don't know, is it left on the doorstep that morning and it was a hot day and it was out there all day and then you put it into your refrigerator? If you actually read the package inserts in some of the hemophilia products, it says that if it gets down to room temperature level, not to put it back in there because it could affect your efficacy. Whether or not it really does, it does say that. So there's a chain of, I only know this because I spent 8 years arguing this in the legislature in Indiana and at the hospital association level, everybody's level. And it's that there is a chain of custody issue. What happens if you go in and something goes wrong in there and they have used your factor? You're going to do what you need to do to take care of your family, right? I'm going to sue them if something happens and I have a bigger expense. They're going to say, but we used what you brought to us. It could have been something you did to it that caused it to not be effective. So I do understand that, but then the alternative is start carrying it, right? So, but yes. And so that is part of the problem with why the hospitals don't do that. And a lot of times they'll switch you on your factor 8 or 9 too. What happens is hospitals can have their own formulary, guys. So while your insurance company says you can get this product, you go into the hospital has their own formulary and they won't use what you have. They'll say, fine, but we'll give you factor 8. We're going to give you factor 9, but you have to use what's on our formulary.